हेलो, आई एम नीरज शर्मा। मैं जब यहाँ विजिट करने के लिए आया था तो थोड़ा नर्वस था। डॉक्टरों से मैंने मुलाकात की और मुझे स्टाफ ने और डॉक्टर साहब ने बड़ी हेल्प की मेरी। और आज आप देख सकते हो मेरा रिजल्ट पहले से बहुत ही अच्छा आया। आज मैं कहीं भी जाता हूँ तो लोग अच्छे से बिहेव और अच्छी सी बात करते हैं और सब पूछते हैं।
If you have a hair loss starting from the front till the crown, that you are not able to make any hairstyle, whatever hairstyle you make, you feel you have lost hair from in between and so your scalp is always visible. If you are afraid of looking at your scalp in the mirror, this video is for you, because today we will be showing you before and after images, videos of one of our patients who came to us with so much baldness from front till the crown, though not as much that there was a shiny balding scalp. He had little thinning hair in between, but still he always wore a cap. And when he came at the chamber, the consultation, and he sat on the chair, I actually had to ask him to remove the cap and show it to me so that we could do the trichoscopy. The results of this patient were so convincing and satisfactory that we presented him for live patient viewing in the World Congress of ISHRS this year on November 3, 2023. The patient was kind enough to give consent and come to the venue to be looked upon by different renowned hair transplant surgeons from all over the world. All of them appreciated the result. After 5 months only, people were actually surprised to see such nice growth, such natural results after 5 months only, and he was much appreciated. So today we'll be learning more about such a patient. My name is Dr. Preeti Saraswat. I'm American board certified hair transplant surgeon, and to subscribe our channel, just press the subscribe button. So this patient came to us with a presentation of hair thinning and hair loss from the front till the crown area. He falls in the Norwood Hamilton grade 5. If I tell you about the history, this hair loss history was majorly for past 3 years, though he was suffering with hair fall for a longer time, but he could relate the past 3 years better. Again, he was casual, occasional smoker, and he stopped having alcohol some 3-4 years back. He took some medical treatment in his own way. He did not see a hair doctor, but he used some Bringa oil by a certain trade name for his hair, thinking he will get some benefit, and he took a normal diet. He was a vegetarian. He occasionally searched online for various treatments, but he did not follow any. So before planning his treatment, we always do a trichoscopy, which is computerized hair examination for the patient, so that we know what is the quality of hair at the donor site, what is the thickness, what is the density, so that we calculate the safe donor area and we know how many grafts we have in our hand for the patient to use today, in this session or later if required. Also, we calculate the recipient area, how much it is required. So for him, when we did the trichoscopy, we could find out that the average hair caliber at the back was 0.076 millimeters. So the hair to graft coefficient was 2.1. It means around 2.1 hairs were present in each follicular unit, in each graft. This is one of the averages. The safe donor area was normal, and we could attain as many grafts as were required for his recipient area and leaving a few behind also. So this was a green signal for the procedure which could be undertaken now, because we had already discussed the long-term treatment planning that he needed to be on medication if he wanted to keep the remaining hairs intact for a longer duration of time. What happens is that if the patient is not extremely bald, they have thinning hairs in between, and we want to transplant hair in those areas, and the patient are willing to take medication, then we can think of them having good hair for a longer period of time, because the remaining hairs will still be present. You can press the like button here if you're liking the video till now. So when we calculated his recipient area, it was 97.5 centimeters square. We had planned to give him the density of 32.5 grafts per centimeter square. Why? Because the donor density was 80, and we can take 40% of the donor density so that the donor does not look thinned out. It does not stand apart, and you can take the graft grafts from there and we can very artistically put them in the front so that a good hair transplant with hairs which they can comb are put. So this density of 32.5 is decent enough to give him a good hairstyle post transplant when he gets the full density after 1 year. So this 32.5 density was given to him. The method used for implantation was pull technique by forceps. This was done in limited frame of time so that we can eliminate all the possible problems which can happen when the grafts are outside. They should not dry, they should not be held from areas where you can crush. All this can be done by trained staff who is doing this skilled procedure for a long duration of time. Post treatment, he was told to have normal medicines like minoxidil, which he was to use 1 ml twice a day solution, and then oral finasteride, which was to be used as per Dr. Nursen's regime thrice in a week, and also multivitamins specifically for hair. He agreed to comply with this because after this he wanted to have those hairs also intact which were thinned out in between. So when you have thinned hair in between the recipient area and you do not take the medicines, they are bound to fall and then your transplanted area will look thinned and you will feel the transplantation has not been good for you. So when there is a proper medication after the transplant surgery, then you are bound to have good result. If you feel you have a similar problem like him, you can ask in the comment section below. Now you can see his before and after images. You can see his hairline is properly strengthened and made. The thinner vellus hairs which he had in the front and both the temples are now replaced by better looking terminal hair, and also in the middle and towards the crown he has good hair now. So the sections which we addressed were both the temples, the frontal hairline, the tuft of hair, and towards the crown on the mid scalp. So all these areas where he had vellus hairs or no hairs at all, now he has terminal looking hairs. At the same time, if you see the hairline, you will see the softness of hair in the front. In the first 2 or 3 rows, we make it a point to place single haired grafts, and that too we divide into 2 parts, very soft and soft hairs, so that very soft hairs are kept in the extreme front hairline and you see a softer hairline, a natural looking hairline with irregular hairlines, so that it is not like a wig, it is not unnatural and it stays like that. So it's a mature hairline because this hairline is not going to go back with his age. It is going to stay. So it should be soft, it should be mature looking. At the same time, the rest of the tuft of scalp should look sturdy and good and natural. If you have any question regarding this, you can always call us for consultation. So I want to suggest here that what are those reasons which actually are behind such good results. So you need to have one-on-one discussion with your operating surgeon before you actually lie down for the procedure. What are your long-term goals? Do you plan to take medical therapy? What are the different good procedures for you, different good equipments for you which you may be requiring, whether your center and your doctor have it or not, and also what are the different things you need to take into consideration after the surgery. So suppose you are going for this surgery now, but you should know that you may have further hair fall in later years and you may need long-term treatment or another surgery later in life. Your doctor should be there for you as a surgeon, as a friend, to guide you and to help you in all the possible latest ways that is here currently available. Also, the operating surgeon should have proper credentials. They should be American board certified. They should be members of different national, international societies like International Society of Hair Restoration Surgeons and also Asian Society of Hair Restoration Surgeons, Indian Society, and they should be prompted and updated of the latest in this field, not only medically but also surgically, so that you get what is best for you. You deserve the best. If you want to know about cost of hair transplant, you can click on the video on the left.